In this segment, I want to focus on some conditions that may not always look dramatic at first glance, but have some pretty notable signs and symptoms. And if the history is rushed or the clinician doesn't ask enough follow-up questions, maybe anchoring too quickly on a simpler explanation, we might miss some of the key hallmark diagnosis. So in this section, exposure history becomes a major tool. Of note, tuberculosis does not gram stain well, and it does have a unique public health profile, so it is good to be aware of some of the key identifying factors. Risk is higher in patients with TB exposure or with ties to regions where tuberculosis is more common. Active tuberculosis raises concern, especially when you hear chronic cough, hemoptysis, night sweats, fatigue, and loss of appetite. Latent TB means the immune system is containing the infection, but treatment is still required. When we examine elements of a TB skin test or other similar testing, it works by asking whether the immune system has seen the TB antigen before. Now, there's a nuance here. The BCG vaccine that may be used in many countries, it might hinder some of the ability to identify some of the diagnosis because this particular vaccine does not prevent the infection completely, but it can modify the presentation, and in that way it does complicate the interpretation. So the broader lesson is that a positive test still demands follow-up and appropriate treatment decisions. Now, students from other countries, athletes, visiting or playing sports, right? They may bring TB with them, and universities or teams that have a community of people who are coming from areas that may have a higher tuberculosis rate may have a potential for the contact or infection of the folks that are around them. Now, when we get a TB skin test, this is where a little bit of TB antigen is inserted under the skin. Now, the key here is if the body has seen this before, then it's going to start secreting cytokines. So if you've been exposed, then CD4 and the innate immunity will recognize this, and they'll make the site of the injection swell. So this is why we do this TB skin test, and you come back in a couple of days and they take a look to see if there's been any reaction. So if you have TB or latent TB with a positive skin test, maybe you have a normal x-ray, looking at the picture on the slide, this one has a nodule, so it would not be normal. But let's say we have latent TB. The immune system is controlling it, and typically patient is going to go on a 6 to 9 month antibiotic program. So latent TB is fairly easy to treat. Now, active TB is more complex, may require some additional pharmacology, but again, recognizing this up front, getting a TB skin test, getting a chest x-ray, making sure that we identify some of these key hallmark signs and symptoms so that we get the proper diagnosis and follow-up treatment. Mycoplasma pneumonia is a classic cause of walking pneumonia, especially in high schools and college-age patients. The patient may have fever, cough, malaise, maybe a headache or muscle ache, and still remain functional, even well enough to go to class, and some might even consider going to practice. Now, that's why it's called walking pneumonia. It can look a lot like influenza, so referral is important for testing and treatment. So this is a nice reminder that not all pneumonia patients look gravely ill at first. Some just look tired, run down, and not themselves. So we'll take the walking clue to kind of help us to identify. Don't just dismiss it as just a cold, but keep in mind we need to look for some other classic signs and symptoms that may give us a hallmark of what's going on. So again, patients need referral for testing and appropriate treatment in this case. Lyme disease is most associated with the Midwest, New England region and the upper Midwest area. So This matters because many college populations may include students coming from those areas, and so recognizing some of these signs and symptoms as they may present could be relevant depending on where students have just traveled, where athletes have just been, or where you work. So it's transmitted by ticks and it's caused by this spirochete bacteria. One classic sign is erythema migrans, which is like a targeted like lesion, but patients may also have fever, malaise, joint pain, swollen lymph nodes, and nervous system complications. Now, Bell's palsy is one example of those nervous system complications. If a patient has facial weakness, do not just stop at this must be a stroke, but rather follow up with some additional questions. Ask about tick exposure, outdoor history, and timing. Early treatment matters in this case. Delays can actually reduce the chance of full recovery. So some of the pictures that we see there, the target lesion, or also called erythema migrans, this is that bullseye-shaped rash, typically appearing 70 to 90% of early Lyme disease cases, and it often appears maybe 3 to 30 days after a bite. So keep in mind that a patient may go on to develop aspects of the central nervous system. And so if you ask the patient to smile, for instance, you see the left side is abnormal, nothing's really happening due to the paralysis of the facial nerve. So we probably need to be looking at referral immediately in this case. The longer we wait, the less likely it is to get better. So follow up with those questions, assess all of those elements of could it be a stroke, but also be thinking, could this be a tick bite? How long has it been going on, right? Ask some of those follow-up questions. Spotted fever is often associated in people's minds with the Rocky Mountains, hence the Rocky Mountain spotted fever, but it's especially relevant in the Southeast as well. So in this condition, patients can look very nonspecific early on, presenting with fever, headache, myalgia, and just looking sick or wiped out altogether. Now later, the rash may appear, including on the palms and the soles of the feet. We can have or observe progression from macules to petechiae, and that palm and sole distribution is a pretty useful clue. Although it's not exclusive to this disease, petechiae is one of the things that we want to examine. Petechiae characterized is these tiny pinpoint sized red or purple spots that tend to appear on the skin due to bleeding from small blood vessels. There's also some other more severe complications, delirium, coma, disseminated intravascular coagulation. And that's an often life-threatening condition, typically characterized by widespread abnormal blood clotting within the blood vessels, and there may even be other factors pertaining to issues with clotting factors and platelets, and that can lead to some severe or uncontrollable bleeding. So of course, this is another diagnosis where the combination of what season we're in, vector history, in other words, being bitten by something, and the progression of these signs and symptoms, all of these factors matter. To keep in mind, with our concerns with the rash, the macules, the fever, the headache, the patient looking very sick, we use the term prostration, meaning extreme exhaustion. So these are all factors that we want to look like when we are considering the bacterial disease that has been spread through the bite of an infected tick. So the main takeaway is that exposure history can change everything. Asking about a person's travel background or history, where they've just recently come from, whether or not they may have been exposed to or identified tick contact or a bite, respiratory symptoms that don't really fit a simple cold, and the symptoms that they are experiencing over time, right? Keeping in mind whether that could present as tuberculosis or some type of atypical pneumonia. And of course, these vector-borne disease, that should certainly be on the radar. So as we're kind of closing with our understanding, we've of course covered tuberculosis, Lyme disease, walking pneumonia, and spotted fever. And again, keeping in mind the sample history is one of the key factors that's going to help identify whether or not some of these conditions may be within the patient.